What is a dental implant? So it's a small titanium pipe that we can insert into the jawbone, and then it becomes part of the jawbone, and then that can provide a stable foundation to put on crowns, bridges, even dentures to replace missing teeth.
Yeah, so it's probably the best option we have. Well, it's not probably, is the best option that we have for replacing teeth. It's the golden standard for replacing missing teeth. There's different modalities to do it, but in essence, it's a painless solution. There is a little bit of local anaesthetic that we give to all our patients to make sure that you don't feel anything. It's a straightforward procedure most of the time, and we'll look after you at the practice. You won't feel too much at all.
When can I go back to work?
If you're Tom, no. Because he's on holiday.
In terms of healing, there's a little bit of a healing period afterwards, but it's similar to removing teeth normally.
Yeah, it's for the vast majority, say single or 2 implants, local anaesthetic, over-the-counter painkillers. Most people will be able to go back to work the next day. It's usually fairly quick. So after a single implant or 2 implants, 3 implants even, probably the next day. More complicated treatments like full arches and guided surgery, you probably need a week to recover. But certainly for 1 or 2 implants, most patients next day back at work.
And in terms of actually placing the implant, between us, we've got years of experience. Michael and Lawrence have been doing things for 26 years in the implant field. It's like it's like doing a filling. We place that many implants a year. It can be as simple as placing a normal filling. It can take 20 minutes, but in some cases it can take a little bit longer. For a full arch of implants, it can take up to an hour and a half to 2 hours, and we do that with a guide, which is ultra accurate. It's the modern way of placing implants. We do a CT scan, and we can get you with same-day teeth, and we'd all agree that same-day teeth is one of the best life-changing options for someone to have implants.
Definitely.
Normally these patients have got failing dentitions, they've had lots of work done in the past, or a denture that they don't like, and not many people do. It's not for everyone, but we can do teeth in the same day. So 4 or 6 implants, top and bottom arch. We can then place a bridge or a denture over the top of the implants on the same day. You have a lovely smile. Some patients aren't suitable, but we'll vet that amongst the 3 of us. And if you come for a free implant chat, we can pretty much work out what's best for you, essentially.
Yeah, so the implant chat is just a 10-minute appointment where we just assess and see whether you're suitable. And if you are, we'll then go ahead and book a more comprehensive consultation where we will take scans, intraoral scans, CT scans, so you can have a look at the bone, some photographs, and discuss your needs, and then put together a comprehensive treatment plan and get you back smiling.
Yeah. The approach that we take here at the practice, there's often a couple of us in surgery together. It gives a little bit of a different perspective and something a bit different to what most practices do. There's not just one of us. You'll feel super comfortable. There's 2 of us. We can do things, we can move things quickly, get second opinions, and ultimately we're trying to aim for the best possible result. In most cases, that's upwards of 96%. And yeah, implants fail, but we'll always take care of you if they do. We'll get you straight back in, we'll identify it. We've got solutions to manage most problems. If you do what we say to do afterwards, then we'll do our part and we'll more than happily look after the implant if it fails, which is rare.
I've lost a tooth. What are my options?
Well, you've lost a tooth. Clearly you want to replace that with either a denture or a conventional bridge, a stick-on bridge, or a dental implant. Now, all of those options you always compromise, but the dental implant would be the closest to the natural tooth that you've lost. The problem with dentures are that they are removable, they alter your speech, taste, function, whereas with a bridge, yes, it's fixed to the teeth on either side of the gap, but in doing so, you cause irreversible damage to those teeth which in the long term will require more maintenance in terms of a tooth failing, needing further treatment. Dental implants is, as we said earlier, is the golden standard to replace a tooth, and in my opinion, by far the most conservative way of replacing a tooth.
Will I need bone grafting for dental implants?
Bone grafting, it is important when it comes to dental implants. There's different levels of bone grafting. I would say for most cases there will be some form of bone grafting, but there's a good reason for that. With bone grafting, we restore more of your natural tissue to give you a more natural outcome. There's some instances that you would be able to get an implant in without doing the bone graft, but then your result will be a little bit compromised. It will look kind of like a tooth, but it won't resemble the real thing. So little bits of bone grafting can be done most of the time at the time of placement. The bone graft really isn't that bad. As a patient, you will be unaware if you had a bone graft in the procedure. It will be up to you.
And we'll know that beforehand with a CT scan, which will take in the assessment stage.
I think that the important thing to sort of highlight as well is that the reason we're doing the bone grafts is that once you've lost a tooth, there is a three-dimensional change in the shape of the jawbone, and the longer the tooth is missing, the more change or shrinkage of the jawbone occurs. You don't just lose a tooth. Yeah, you
lose the bone as well.
The bone as well. So when we replace the tooth, we need to replace the bone that you've lost as well.